Seem to be much more about the person, the people that we support, people that we work with, and what's a person's life like, rather than how we go about trying to support that with people.
Yeah,
it seems to be much more about your life and how you're leading it, rather than the needs that you have. Because there's a sense from previous care standards, understandably so, that it focused on what your needs were, because you had a support need. It seems to be much more about life, which makes it's a much more of a comfortable fit for what we feel we're all about.
Yeah, and I think it, you know, if you're going out to speak to people about their support, it's much more conversational. You know, it's much more based around, you know, their lives. What does it mean to them to kind of have support? How do they experience that? And what can we do to make that better? So I think it's given our workers a much better focus for going out and doing that assessment, conversation, support planning. Stuff with them.
There's the two versions now, which so people who haven't anything to do with care can actually read the standards and understand what they're expected of good care. And to be honest, it's what we've actually been trying to achieve for years, and it's just putting it down in paper, and they are so achievable this time.
It is very welcomed, I think, and the more activity we get involved in around the new care standards and familiarising ourselves with them, the more of a difference I think you feel when you're having conversations with people about it.
Before, you know, that list of standards that we had would have been really difficult to sit down with the people that we support and have a conversation about what the standards were saying, whereas these standards are actually, there's a lot less of them, but I think they say a lot more.
I know, and there's
and that there's,
totally.
You know, they're actually something that you could sit and have a conversation with service users, carers, and sort of really help them to understand that they're for them.
Yeah, absolutely. Because I think it's language that's really meaningful to our frontline support staff. You know, like the inclusion of the term compassion as an overarching principle, and getting people to think about how they compassionately support people. And also that whole bit of the principles around responsive support, that's a really new way of describing the multitude of activity that goes on in people recognising and responding to changes in people's life, whether that's a change in a need that somebody has or just a change in lifestyle. But it's one of these skills that I think our staff just have an abundance of, really getting to know people that they support, to be able to recognise when things are changing, and then just how quickly people respond to that, and in such, you know, clever and creative ways.
So what we've done as an organisation is we've actually started reviewing the workforce development and regarding induction training. If they ask them about the standards, the workforce will be able to answer appropriately.
We've done a lot of work over the last few years around outcomes focused assessment, and even within eligibility criteria, what does that mean in relation to outcomes? And so the standards coming through, what we're doing is trying to encourage our team managers to kind of sit down with their teams and talk through the standards. You know, what does that mean in terms of the role that they play going out, carrying out assessments, and okay, so we've got eligibility criteria about what might attract funded support, but we're looking at it as much wider than that. So in terms of people's outcomes, even the stuff that happens that's not part of funded support, you know, what happens in people's lives, what happens in their communities, and how do we apply the standards right across that person's life, in terms of, you know, helping them to understand what those standards mean for them, not just from the support that we might put in, but in support in general, and how their lives are, and the lives of their families and their carers, how that all fits within that. So just trying to get people to think through how the care standards fit into all of that as part of our workforce development within teams, and then wider than that, any other sort of training that we're doing, how that all embeds into that.